Hi there, my name is Mycobacterium tuberculosis, though most people call me tuberculosis, or TB for short. I'm a non-motile rod-shaped bacillus, and the infection and disease I cause is tuberculosis, which mainly affects the lungs. It's the leading cause of death in the world from a bacteria, and according to your CDC, I roughly affect 1.8 billion people around the world. That's pretty cool for a bacteria. There's some other cool things about me is that I'm an obligate aerobe. But I can also be a facultative intercellular parasite when phagocytized by a macrophage. Though what I like most is my body, my cell wall structure. It's mainly constructed of this waxy lipid layer, mainly macolic acid. It makes me nice and strong. Though another cool thing about my strong lipid cell wall is that it makes me impermeable to some of the basic staining techniques out there, like gram staining. So therefore, I'm not classified as a gram-positive or a gram-negative bacteria. You have to use the Zilnelcid stain method, which is an acid-fast method, and this will stain me a pink color. And this makes it harder for the scientists and doctors to recognize what I am. Though when those doctors and scientists want to try to figure what I am, they have to grow me, and they grow me on the Middlebrook and Lowenstein mediums. Though I generate kind of slow, so it takes 4 to 6 weeks before there's some visual colonies. And when I do show up, I have colonies that are pretty small and buff in color. So this all sounds pretty cool, and you're wondering, what makes this bacteria such a bad little guy? Well, let me tell you. Well, first off, it only takes less than 10 of me to infect you and start an infection. This makes me very virulent. I also can survive for an extended period of time as an airborne droplet from when someone expels me by coughing, sneezing, talking, and even singing. But where I work my real magic is after you inhale me, I can bind directly to the receptors of the macrophages, and I can also grow intracellularly within the macrophages, and this evading your immune system. So once I'm in the macrophage, I create and secrete a vast number of different proteins and enzymes to help protect me from the immune system and protect me from the macrophage so it won't digest me and destroy me. Though what I like to use the macrophage for is to reproduce inside. And when I reproduce, I do it very slowly. It takes between 15 and 20 hours for me to reproduce. And this is an added benefit because it helps me hide from your immune system. But still, my favorite defense mechanism is still my macolic acid layer. It helps protect me from those macrophages, but it also protects me from antibiotics, acidic and alkaline compounds, and helps protect me from lysis from complement disposition. It also helps keep me moist so I can survive extended periods while I'm an airborne droplet, looking for my next host to infect. So all of these factors can lead to a very serious disease, which cause some severe inflammatory response and can cause tissue damage, not only in the lungs, but anywhere I spread throughout the body. So you may wonder who I can infect. Well, lucky for you, I can only affect humans. Though my microbacterium cousins, they can infect monkeys and humans, cattle, sheep, goats, dogs, and even cats. So now you're probably wondering how I get around. That's pretty easy when I'm active. If you're coughing and sneezing, talking to someone, or even singing, as long as you're expelling me from your lungs, I'm going to come out in droplet form and hang around in the air. I could survive a long period of time outside, airborne, floating around. And the next person will just be walking around unsuspectingly and inhale me. It only takes a few of me, and I'll start an infection. And you won't even know this for about 2 to 12 weeks. And then I can turn a skin test positive. Though even though the skin test may be positive, doesn't mean I'm active. All of this hard work trying to get to my next host may make me tired, and I may just become latent and not become active for several months to several years, until your immune system gets compromised, and then I become active. So now you're probably wondering what happens when I infect you. Well, me and my buddies hopefully will make it all the way down to the alveoli. There, the alveolar macrophages will engulf us and try to kill us. But, of course, we make specific enzymes and proteins to help protect us to prevent this from happening. Instead, we reproduce, and we keep reproducing until we burst the macrophages. This process keeps repeating, forming tubercles. As more tubercles are made, the immune system initiates the cell-mediated response with the T cells. The T cells encircle the tubercles, forming granulomas. The granulomas block off the TB from spreading. Inside the granulomas, the tissue dies in a process called gaseous narcosis. This is then known as the Gone complex. As the Gone complex calcifies, the results can show up on X-rays. This calcification then is known as the rank complex. From here, if the bacteria is not contained, it can spill over into other systems of the body. This is known as systematic miliary tuberculosis. On the other hand, if the tuberculosis is contained, it may be killed off or become latent. Here, it may be reactivated sometime later down the road, several months to several years, and this would become a secondary tuberculosis infection. Though in any case, with the active tuberculosis, the activities in the lungs and the inflammation buildup will increase the sputum and blood, and this resulting in coughing to expel the buildup. The resulting coughing and sneezing then expels the bacteria, releasing it back into the open environment. Once again, the process will start over when a new host inhales and is infected. So what's some signs and symptoms that I've actively infected you? Well, most likely you'll have a fever, some night sweats, the chills, you're going to lose some weight, you'll have a loss of appetite, you'll feel a little fatigue and have some weakness, you have some chest pain, and you'll definitely have a persistent cough that lasts more than 3 weeks. But don't be surprised if you start coughing up blood and have some excessive sputum when coughing. Now, if you're showing some of those signs and symptoms, you're wondering, how are you going to treat me? Well, you need to first be positively ID'd that you have tuberculosis. And if positive, then they're going to start you on a regimen of antibiotics. Depending on your age and your overall health, this regimen could last anywhere from 6 to 9 months. And if possibly drug resistant, this regimen can last anywhere from 20 to 30 months. Though there are 4 main antibiotics that are commonly used: rifampin, isoniazid, ethambutol, and pyrazinamide. In any case, it's vital that you take all your antibiotics on a regular basis and you complete the regimen. This will ensure that you kill me off. Though the best way not to contract me is to have a good prevention and control program. The simplest part of this program is to cover your mouth when you cough and sneeze. This is practicing good etiquette to prevent airborne droplets. Another simple procedure in the program is to practice proper hygiene, to include washing hands and properly cleaning, sanitizing, and disinfecting equipment. To control the environment, it is best to identify the infected patients and alert staff. Take airborne disease precautions such as wearing masks and wearing respirators as necessary. The room should also be properly ventilated with the infected patients. If there has been an exposure, you should notify the proper personnel to let them know that they have been around a positively infected person. If you work in an environment that may be exposed to TB patients, you should have regular PPD skin tests done. Though there is a vaccine for tuberculosis, it is called Bacillus of Clement and Garoon, also called BCG, though the vaccine is not widely used in the USA. I hope that gave you a good overview of Mycobacterium tuberculosis. If you have any questions, just let Landon answer them for you.